Hi, I'm Dr. John Crisler of drjohncrisler.com and allthingsmale.com. I've been practicing interventional endocrinology for 16 years and treat men with testosterone replacement therapy and women for their sex hormone issues too. I also raise growth hormone levels without using growth hormone. I was one of the first physicians in the world to recognize and treat the dreaded post-finasteride syndrome. I also specialize in thyroid and adrenal support and optimization for both men and women, as thyroid and adrenal hormones are as hand in glove, because it takes cortisol, well known as the stress hormone, to get thyroid hormone into the cells. Otherwise, the blood is just a reservoir of thyroid hormone that does you no good. Today we're here to talk about thyroid optimization. This is a major concern in the world today, because not only are there tens of millions of people in America alone who suffer from low thyroid, the gas pedal or a thermostat if you will for the whole body, and not being treated properly, but there are very few doctors who really know how to diagnose and treat it. So we end up with a bunch of people who are left sick, weak, and depressed, their lives ruined. Or worse, on antidepressants, psychotropic medications that powerfully affect how your brain works that you don't really need and can be really hard to come off from. What are the symptoms of low thyroid? Fatigue is definitely number one, but also weakness, weight gain, no matter how hard you try a diet and exercise, brain fog, and even sexual dysfunction. Your skin may be dry and hair falling out, even constipation, even when you're drinking plenty of water. And this can all happen while your laboratory tests look completely normal. What normal is and is not will be the subject of a future podcast. Just a little endocrinology is useful at this point. The thyroid gland makes mostly a form of thyroid hormone called T4, but T4 is just a prohormone, and it must be converted into its active form called T3 out in the body. If T4 does not convert into T3, no matter how much T4 you have, you are still low in thyroid hormone, since there is none available that actually works. And therein lies the problem, because there are many factors which inhibit the conversion of T4 into T3. Things like stress, no shortage in the world of that these days, lack of sleep, many drugs doctors regularly prescribe, dieting, and how does low thyroid help you lose weight, and all manner of nutritional deficiencies. That is also why you cannot possibly properly evaluate a patient's thyroid function just by testing TSH, which is short for thyroid stimulating hormone, which is what most doctors do. More on that later. Further, most doctors only prescribe Synthroid, which is a form of only T4. Remember, we just talked about the fact that it must be converted into T3, and how if it does not, does you no good. In some cases, you start taking Synthroid, and if something called reverse T3 is being made from the T4 instead of the regular T3, you actually get worse. If that has happened to you, now you know why. Now let's talk about laboratory testing. I teach this stuff at medical conferences all the time. It really isn't that complicated, and it's been known to science for decades. You just have to know what you're doing and put your patient's care above all else. As we said earlier, many doctors follow thyroid function by only checking the TSH level. And again, that completely ignores potential failure of T4 to T3 conversion and of conversion to reverse T3. So in order to properly test thyroid, the laboratory panel is a TSH, a T4, and a T3. Maybe reverse T3. Not to get too complicated, but hormones are usually chaperoned around the body by things called carrier proteins, which also bind them up. So we must check what's left over, called the free levels of these hormones. That means if we want to find out what the real level of the thyroid hormone down where the rubber hits the road, the single best test for thyroid is the free T3. If your doctor won't run that test, find one who does. Sometimes we test reverse T3, and if you happen to have Hashimoto's hypothyroidism, test for the antibodies the immune system inappropriately makes that actually destroy the thyroid gland. I've got treatment protocols in every case. We also may check ferritin, which is a protein that is a good measure of stored iron levels, especially in women who are still having their periods. Low iron negatively affects thyroid function and is in of itself a cause of fatigue and anemia or low blood. Most people, despite what conventional medicine would have you think, are quite deficient in iodine, so we usually recommend iodine supplementation. It's cheap, effective, and extremely important for your health. And yes, we do use iodine in patients who have Hashimoto's. Again, you just have to know what you're doing. We'll talk more about that in a future podcast. So, if you find you're not converting T4 into T3 very well, or are making too much reverse T3 instead, then we need to add in some extra T3 so you have enough. That is done by either adding some pure T3 or the natural form of thyroid, which contains both forms of thyroid hormones and a bunch of other stuff you need, called natural desiccated thyroid. It comes from the dried thyroid glands of either pigs or cows. If you get your thyroid function properly tested and you are not converting T4 into T3 well, or have too much reverse T3, and your doctor won't give you the proper medications, find one who does. It's as simple as that. This is very important, not only for your health, but your happiness as well. And think of your family. Legally, as a physician, I must see you in my office in order to prescribe medications or even to order labs. If you can make it to my office in Lansing, Michigan, we can do what we want and also take care of other medical issues as well. Your diet and nutrition will be checked then too. But if you can't come to my office, and there are so few doctors around the country who really know what they're doing with hormones, and this surprisingly includes most endocrinologists, I offer what we call the advice-only consultation. That is where you get 30 minutes with me, one-on-one, over the phone. I can get most cases solved through the advice-only consultation. Now, while I can't write for labs or prescriptions by the advice-only consultation, fortunately there are now numerous medical services around the country that allow patients to order their own labs. We will tell you which ones to get. Now for the issue of getting medications. Luckily, there is now an over-the-counter form of natural desiccated thyroid that you can buy yourself that really works. It's called Thyrovance, and it comes from cows. At the same time we are talking about your thyroid or sex hormone or libido issues, we also consider your adrenal function. As I said earlier, thyroid and adrenal are as hand in glove. Now everyone can get the medical advice they need to not only treat illness, but optimize health and happiness. Thank God for the internet. I hope to talk to you soon.